This is a download from the Clinical Audit Support Centre Limited. To find out more, visit www.clinicalauditsupport.com. Hello, my name is Stephen Ashmore and I'm the Director of the Clinical Audit Support Centre. The purpose of this short enhanced podcast is to tell you more about the Practice Managers Study Day that took place at the Hilton Hotel in Leicester on the 16th of September 2010. Approximately 80 delegates, mostly practice managers from Leicestershire, attended the event that was organised by the Clinical Audit Support Centre. The Study Day is an annual opportunity for local practice managers and practice staff to get together, listen to national and local updates and share grievances, experiences and ideas. As always, the Study Day was supported by Brenda Sutherland's General Practice Training Department. Full details of the work of the department, who run a wide range of training courses for practice staff, can be found by visiting www.llrtrainingservices.nhs.uk. The day kicked off with keynote speaker Paul Samra, Head of Healthcare at Kingston Smith Chartered Accountants. Paul's presentation focused on the important matter of boosting practice income, and he left delegates with 3 key top tips. Number 1. Make sure you prepare and review your quarterly management accounts and budgets. Number 2. Benchmark your results, i.e. calculate income per patient and staff costs per patient, etc. Number 3. Introduce childcare vouchers and ensure you make the maximum claim for capital allowances. To find out more about Paul and his team, visit www.kingstonsmith.co.uk. Paul was followed by a valuable presentation from Sarah McIntyre and Fiona Stevenson, who both work at the Care Quality Commission. Their session focused on the key matter of preparing for registration with the CQC. Perhaps the key general point from their session was that in terms of monitoring of ongoing compliance, the CQC will be focusing on the experience of people who use healthcare services and using their feedback as a significant part of the CQC's decision-making process. For more information on this, please visit www.cqc.org.uk/guidanceforprofessionals.cfm. In terms of specific advice for GP practices, both Sarah and Fiona urged attendees to familiarise themselves with the regulations and the CQC's essential standards of quality and safety. All the relevant information can be found via the CQC website. The relevant link is www.cqc.org.uk/guidanceforprofessionals/primary medical services.cfm. After the main presentations, all attendees had the opportunity to attend a series of 1-hour workshops. Andy Cope from artofbeingbrilliant.co.uk delivered an excellent session focusing on effective leadership, and his key point for attendees was that as practice manager, you set the tone for the day. If you are positive and upbeat for the first 4 minutes every day, this will rub off on those around you. Kim Campion from the alternativealternative.com delivered an interactive workshop on how to deal with stress. She provided delegates with lots of ideas, and I particularly liked her suggestion that we should all have an uplifting song close at hand that makes us feel happy whenever we hear it. Kim's motto for the day was that when you feel good inside yourself, you can handle anything outside yourself. The third workshop on offer to delegates was organised and run by Teresa Simcock, employment law consultant from the AP Partnership. Teresa's session provided updates on employment law, and attendees were able to review various materials and resources during her workshop. After the workshops, Kavita Oberoi delivered the keynote presentation to conclude the day. Kavita is the founder and managing director of Oberoi Consulting, and her presentation focused on maximising QOF income and improving clinical outcomes through data management. Kavita's presentation was well received and she made a number of valuable points. Changes in the GMS contract for 2009-10 have led to some practices losing potential income under the Quality and Outcomes framework. At its inception, Adjusted Disease Prevalence Factor, known as ADPF, gave some protection to practices with low disease prevalence by utilising a square root formula in its calculation. The revised payment system saw the removal of the square root formula in 2009-10, followed by the removal of the 5% cut-off arrangements in 2010-11. Practices will now receive QOF income based on their true disease prevalence. The overall effects of these changes are expected to be cash neutral across the UK. However, some practices are subject to a significant loss in their current income. At this stage, it is imperative that each practice is aware of their current disease prevalence, benchmarked against both the national average and the local PCT average. Carrying out this analysis now will give practices the time to both 1. Identify patients who may have been miscoded and are missing from the registers, and 2. Getting involved in screening new patients that may be part of a local enhanced service. This may be the final QOF year that prevalence calculations may work like this, so practices should undertake this work as soon as possible to gain the benefit. If you need support in this field of work, visit www.oberoi-consulting.com for more details. Overall, the study day evaluated exceptionally highly, and the general view from delegates was that the event proved a great success. We would like to take this opportunity to thank all of those involved in the event, especially speakers, workshop leaders, and sponsors. As part of the day, delegates were invited to flag up websites that they use on a regular basis and find helpful. A total of 7 invaluable websites for practice managers were flagged up, and their details are as follows. Number 1. www.firstpracticemanagement.co.uk. This is a veritable goldmine for those working in general practice, and the site includes open forums, latest news, and access to all sorts of invaluable documents. Second, we should mention surveymonkey.com. This provides a range of resources and is particularly cost-effective for those who want to carry out quick online surveys and questionnaires. Thirdly, nhsdiscounts.com is a site that enables NHS staff to access great savings and offers. Membership is free to all NHS employees. Fourth, we should mention the Primary Care Commissioning website, where you can visit at www.pcc.nhs.uk. This site has lots of up-to-date information on commissioning, plus a comprehensive QOF management guide. Fifth, the BMA are available via www.bma.org.uk, and this site is packed with useful and helpful resources. Sixth, the NHS Business Service Authority can be accessed via www.nhsbsa.nhs.uk. There's lots of interesting information from counter-fraud to NHS pension information to a helpful contractor payment section. Finally, we'd like to mention Patient Opinion. This website can be accessed via www.patientopinion.org.uk. This is a fascinating website that empowers patients to feedback on the quality of care they've received. Visitors to the site can search for patient comments, good and bad by organisation, and the site provides a first-hand account of what patients' views are in terms of the care that they receive. This concludes the podcast looking at the Practice Managers Study Day. If you attended the event, we hope you had a great time. And if you didn't, we hope that you found this podcast useful. The next conference will take place in 2011, and full details will be available via the Clinical Audit Support Centre website in due course. This broadcast was recorded on the 20th of October 2010 and is copyrighted the Clinical Audit Support Centre. Reproduction of this download is prohibited. Rebroadcast of this work is forbidden without the express written consent of the cast team.